I then did get bitten by a dog. Thankfully, he turned out not to be a rabid dog, but then having to go to the pharmacy, a hole-in-the-wall pharmacy, where you wonder how the rabies vaccine has been stored, and giving yourself a couple of injections to top that immunity up. It's a pretty scary situation.
Welcome to the Call the Vet Show, the podcast that helps pet parents understand and optimize the health of their furry family, so they can live the full and happy life you want for them. And here's your host, veterinarian Dr. Alex Avery.
Hello, kia ora. Welcome back to another episode of the Call the Vet Show. And I'm bringing you another question this time. And this question is from Jan with what is, a topic that has been a really hot potato for the last few years. The COVID pandemic really accentuated the fears around this topic, and you can probably guess what I'm talking about when I say that. And it's one that I think it's really important that we address, because there's a couple of big issues with this question that are raised. I have my opinions. I'm sure you have yours. If you have a question like Jan, or you want to comment on today's episode, then I'd love to hear from you. You can head over to ourpetshealth.com/question. There is also a link in the show notes of this episode as well. And like I say, not just for questions, but if you've got an audio comment that you'd like to share with everybody, then I'd love to hear from you as well, because let's have a constructive conversation about this topic. I'd love to hear what your thoughts on this are. So without further ado, here is Jan.
And now, on with the show.
Long story short, my dog was vaccinated before he actually needed the vaccinations. What are some of the side effects? Do they happen quickly? Is it anything to be concerned about? I know for sure it was rabies, bordetella, and I believe those were the two that he didn't need. We only took him to get a flu shot. And long story short, they just read his records incorrectly because it wasn't our main vet. Any input is appreciated. Thank you.
Thanks so much for that question, Jan. It's a common concern, vaccination, over-vaccination. Should we be vaccinating at all? That's the extreme version, or we shouldn't be vaccinating ever, is the extreme version. Well done on getting the vaccines. I think that they are really important. Clearly, it's a big core strategy to prevent some of the most dangerous infectious diseases there are. As I'm talking to you now, there is actually currently parvovirus outbreaks in various different parts of New Zealand. Thankfully, not where I'm practicing, but those outbreaks wouldn't happen if vaccination levels were higher. Dogs are dying. They're really nasty, nasty diseases that we are preventing through vaccination. That being said, we absolutely don't want to over-vaccinate. So to discuss that and whether it's a concern, I guess we need to consider what normal vaccination programs are and normal vaccination recommendations are. So when it comes to our puppies, their initial vaccinations, they start at normally about 8 weeks of age. Now, if we've got a puppy in a high-risk area, maybe the mother was in poor health or had low immunity, then we can start at 6 weeks. But 8 weeks is typically when we start. Then we vaccinate every 4 weeks or so, with the final vaccine at 16 weeks of age. That recommendation is based on the WSAVA, or the World Small Animal Veterinary Association's vaccination guidelines. After that initial set of vaccines, we then give a booster vaccine from 6 months of age. More often it's given a year after that puppy course. And then the core vaccine is every 3 years. And by the core vaccine, I'm certainly talking about parvo, it's distemper, it's hepatitis. It's these core vaccines that all come in kind of one shot. Now, when we are thinking about, should we be vaccinating every 3 years? Should we be doing it more frequently than that? We know the core vaccines, they last for at least 3 years. Now, there are going to be some dogs where it lasts for longer than this, and sometimes substantially longer. So it might be 5 years, it might be 7 years. It might even be lifelong immunity in some cases. So the question then becomes, well, should we vaccinate at that every 3 years to make sure that we're covering ourselves and we're covering our dogs as best as possible. Should we do something called titer testing? So should we look at antibody levels to see if they're still high, and that infers that there is adequate protection from those diseases? That's certainly something to think about, and I don't think we'd ever be wrong to do titer testing. There can be difficulty sometimes in interpreting that with absolute certainty, but it is a valid tool. Now, the problem with titer testing, if you like, is generally financial. It does come at a significantly higher cost than just giving a vaccination. So we then need to think, and I guess the nature of Jan's question is we then need to think about what the side effects of vaccination are. Now, we can have anaphylaxis, we can have an allergic reaction to a vaccine. That is typically why, say, when we go to the doctors for a vaccine, we're recommended to stick around for 20 minutes after having that shot, just in case we develop an allergic reaction, an anaphylactic reaction to that vaccine, which can absolutely be life-threatening. Now, the risk of that is minuscule. It's not something that I've ever had experience to any of my patients. I've spoken to colleagues about this, and they've never had it experienced. They've never experienced that with one of their patients. So it's not something that I've ever heard of kind of secondhand, if you like, although I'm sure if you jump online, there'll be reports of that. But the risk is very, very low. Now, the risks for longer term vaccination and more frequent vaccination, this is where we get into some, dare I say it, serious conspiracy theories. Now, I'm not for a second, don't get me wrong, I'm not for a second saying that we should be vaccinating more than this, or there's no risks with over vaccination, but I think the risks are massively overblown. There is a suggestion that we may get an increase in some autoimmune conditions, so some conditions where the body's immune system actually then starts attacking itself, something like an immune-mediated hemolytic anemia, which is where the body's own immune system breaks down the red blood cells. Sometimes that's accompanied with platelets, and sometimes that's accompanied with other white blood cells, and that can be catastrophic and really serious. The exact trigger for that is very challenging to determine. In some cases, it may well be that a vaccine has triggered that. More often than not, it's probably going to be some form of maybe a cancer of the blood, maybe a viral infection, some other environmental stimulation. And in all likelihood, these are multifactorial diseases that thankfully are very rare anyway. So they're not something that really we need to be worried about. And certainly the risks of those are not outweighed by the risks of not vaccinating. I do come across situations where people have still been recommended to have the core vaccine every year, and that's your parvo shot with distemper, like I say, and hepatitis. That really is excessive. There's no justification for that. Now, do I believe that's risky? I don't think that's going to carry any greater risk really in the grand scheme of things, but it's completely unnecessary. So why do we want to be doing something that's completely unnecessary? My thoughts are that we don't. If anything, if nothing else, it's a waste of money. Health checks every year, absolutely really good idea, but that doesn't mean that we need to be giving an injection with that health check when it's been shown to be, every 3 years is absolutely as frequently as that vaccine needs to be given. Now, other vaccines, and these are going to be I hesitate to say lifestyle vaccines, but are non-core vaccines which are based on the risks to your particular pet and your particular part of the world. So something like leptospirosis, that's a serious, really serious disease. If that's in your area, then that could be considered, and probably should be considered, a core vaccine. That one does need to be given every year. Bordetella, so our kennel cough or canine cough. Again, if your dog is mixing with lots of other dogs, if they're going to boarding facilities, daycare, groomers, then that's a high risk situation. It's not a fatal disease. Generally, it can cause some really nasty pneumonia in an older dog who's immunocompromised or a young puppy. Then, there can be fatalities, but that's very uncommon. But it can cause our dogs to be pretty unwell. We get outbreaks of that probably every 6 to 9 months. I'll see a load of dogs coming through that are pretty unwell. They need some TLC and some medication to keep them comfortable and help them through that. That again is an annual vaccination that's required because the immunity is very short-lived. In high-risk situations, it can actually be beneficial every 6 months if there's an outbreak, for example. And then there are other various vaccines that are available in other parts of the world. Rabies, clearly, that is a core vaccine if rabies is in your area. If you're in the States and maybe other parts of the world, then rabies is a vaccine that is a legal requirement. We do not want to mess around with rabies. We don't want to ignore that. It is a fatal disease. It kills loads of people throughout the world every year. And having practiced in India for a short period of time as a volunteer, we had to have rabies vaccines personally before we went on that trip. I then did get bitten by a dog. Thankfully, he turned out not to be a rabid dog, but then having to go to the pharmacy, a hole-in-the-wall pharmacy, where you wonder how the rabies vaccine has been stored, and giving yourself a couple of injections to top that immunity up. It's a pretty scary situation. So we don't want to be messing around with that. Equally, if we're giving an extra one by mistake, and I don't know how this happened, Jan, if the records weren't kind of clear in the previous clinical history, or if you are going to a new vet and you don't have a vaccine record with you and you're going for vaccinations, then you're putting your vet in an impossible situation of either risking under vaccinating, so not giving something that your dog needs, or over vaccinating. As in this situation, maybe there was a lack of clarity around whether rabies was needed or not, and to be on the safe side for rabies, then that's maybe the prudent thing to do. But always go with your vaccination record. I imagine in most parts of the world, if not all parts of the world, when your dog gets a vaccination, they have a little booklet that gets the stickers or the details of the vaccine put in there, and then it gets dated and signed, and there should be an indication of when the next vaccination is due as well. So take that along with you. I guess the bottom line from this rambling, and I've gone in a few different tangents here, is that we need to make sure that we're vaccinating appropriately. Vaccination is incredibly valuable. It's an incredibly valuable tool in the preventive healthcare plan of any individual. We want to make sure that we're vaccinating enough against the diseases that are a risk to your dog. If, for example, your dog stays on your property, it never mixes with any other dogs, then they do not need the Bordetella, the canine cough, the kennel cough vaccination. It is unnecessary for that individual. So we do need to do a risk-benefit analysis. But equally, at the same time, we don't want to be giving anything more frequently than needed. Certainly, core vaccine with your distemper parvovirus given more frequently than 3 years is completely unnecessary and unjustified, and is something that I do occasionally come across with people who have been to other vet clinics, which is always very disappointing to see. Titer testing can play a role, and I'll leave links to some of these other topics as well in the show notes.
Helping your pet live the happy, healthy life they deserve.
So head over to those show notes where I'll leave links to a number of different articles about vaccination and Titer testing. I'll also leave links to the WSAVA, the World Small Animal Veterinary Association's vaccination guidelines, which are guidelines that were produced by absolute experts in the field of immunity and in vaccination and preventive healthcare. So head over to those show notes. And until the next episode, I'm veterinarian Dr. Alex. This is the Call the Vet Show, because they're family.
That's it for this episode of the Call the Vet Show. Be sure to visit callthevet.org to join the conversation, access the show notes, and discover our fantastic bonus content. We'll see you next time.